here at Riverside, when we first meet with patients, most of the time they're at their rock bottom. It's integral that from the minute you walk in that door into admissions that there's that air of trust. That trust is extremely important. This is the one area, the one bastion of safety and support where you feel like I can really be me, I can feel safe and know that I'm going to be taken care of in a safe way.
Someone who's in active addiction or alcoholism or suffering a mental breakdown, this is the best place to come to. And as a peer, I can sit next to them and help them understand a way of recovery. Because addiction is a cycle. Alcoholism is a cycle. And so recovery helps break that cycle. I can understand where they're coming from because I've lived it. I've been homeless, I've been drug addicted. For me, at the end, I didn't have anybody. My mom said, no more. My family told me I was hopeless.
Addiction affects everybody. It doesn't matter your race, your culture, your financial status. Once your brain is altered, you instantly become addicted. We've had ages ranging from 18 and all the way up to 88. I have a very long history of alcoholism and substance abuse within my family. Both of my parents are 20 plus years in recovery successfully. And we have 10 of us, siblings, and 6 of them are in recovery from heroin. You never want to see that person that you care about fail. Being able to say, like, I have 2 parents who have 20 plus years clean or 20 plus years sober, it kind of gives some people some inspiration because not everybody makes it that far. We have a lot of addiction education, relapse prevention, healthy coping skills to learn, ways to cope with external and internal stressors, things to do to keep them busy and to take their mind off of intrusive thoughts, educating them on the impacts of their addiction, whether it be alcohol or illicit substances. So once you're assessed, we kind of evaluate what level program would be most beneficial to you as far as your treatment plan, and then we take it from there.
We provide individual therapy that's consistent across the board for all our patients from the beginning of their treatment to the end, and that's individualized. We provide group therapies. There is psychoeducational therapies as well as coping skill groups. There's art therapy and rec therapy as well as spiritual groups here. So we provide a wide array of both individual and group support.
The individual therapy portion, they're able to confront a lot of internal issues that maybe they're not as open to sharing within a group. Our recreational therapist, she teaches you mechanisms to do when you're alone and you're bored to help prevent that relapse from occurring. We have our pharmacists come in and teach you why medication management is so important. And then we have our peer recovery specialist who kind of takes that role as I've been there, you know, I can help you see how to change or what I did to kind of give them some insight.
The disease of addiction just causes chaos. My mom doesn't want me, my aunt doesn't want me, you know, nobody wants to deal with me anymore because I'm a liar, I'm a cheater, and I'm a thief. There is hope. There are people who care. There's, you know, doctors here and practitioners here and therapists here who can help you. Everything we do and say here, we want you to succeed.
In terms of treating, it's really about providing skill building that increases the individual's ability to really take control of their world, be able to take control of their behavior, and realize that it's really not us making the change, it's them. I think sometimes people have almost misconception that when we experience sadness, anger, anxiety, that we just want to completely get rid of it. The reality is that those feelings are necessary, and they're beautiful, and they're part of us. The key with mental health is being able to manage those and use healthy coping skills and other interventions to help address them in the healthiest way possible. And to realize that depression and anxiety is honestly not much more different than having diabetes or heart disease. It's something that you can live with, it's something that you can treat, and have a life worth living.